I am a relatively recent graduate from a residency program and fellowship myself, and I can tell you that the amount of supervised independence they get here definitely second to none. There is a number of patients with very interesting pathologies and diseases that you don't necessarily get to see in most urban populations, and so they get to see a wide range of diseases in an area that allows them to use their critical thinking as well as their surgical skills and practice that in a very high volume and very sick patients, so that when they go out and practice, it becomes almost something that they've seen at least once or twice, even in the setting of complex cases, but definitely plenty of the common bread and butter general surgery cases that we see, so that they feel comfortable in what they're doing.
At Marshall, we have an amazing patient population and a great pool of patients and an area to draw from. Marshall serves as the tertiary care center for the surrounding area, and as such we get a lot of the more complex cases that are from the tri-state area. As a resident, even before I entered my 5th year, I had already scrubbed in enough cases to graduate, which can be a concern for other residencies in the nation, especially with COVID. Was still able to cross 900 surgeries by the end of my 4th year.
I think Marshall is a wonderful place to train. I love it here. If I were to do it again, I would not go to any other surgical program. The attendings are wonderful, the residents are wonderful, and we get a great operative experience. And we do very well on our app site, and we match very well into fellowships. So I think this is a wonderful place to train.
If you want to be a competent and excellent surgeon, the training here at Marshall, I believe, is unrivaled. The cases that we see, the autonomy that we are awarded, doesn't compare.
So simulation plays a huge role in terms of their training, because what they do is they get a more realistic but virtual, safe environment where they don't have to worry about harming any patients, but they can actually practice over and over again, try out the extent of their skills so that they can see how far they can go. We can give them real life feedback as well as also see what they've done when they practice, because it keeps track of what their outcomes or what their steps were like, so that it gives them a real-time feedback in terms of how well they're doing in areas they can improve as well. So it plays a huge role in their training.
Didactic protected time is super important, because that's the one time we all meet as a group and we discuss cases, we discuss app sites, topics, we discuss oral board exams. So it's very important. The program emphasizes protected time. Actually, we're all protected. We don't do any clinical duties during that time.
We've had multiple residents go into, we just recently had someone get into Harvard in their minimally invasive program. We had minimally invasive to plastics to cardiothoracic surgery, you name it, the residents have gotten into it. You have more than enough support here, and a lot of the attendings have connections to these outside places.
The experience that I've had with my attendings here at Marshall has been excellent. I have the personal phone numbers of each of my attendings, and I'm never afraid or intimidated to go ahead and text them or call them with any issues that I do have, whether it's personal or with a patient.
So each of the 2 hospitals in the community have put their money where their mouth is, so to speak. They have got new service lines. They assist the School of Medicine and the departments to be financially solvent over the years, and if it weren't for the institutions, we certainly wouldn't be able to survive. On the other flip side, the VA is a federally funded institution. We are very fortunate to have multiple military people in the state of West Virginia. They still come for medical care, and from medical care comes surgery. We're busy out there with routine gallbladder operations, colon resections, lumps and bumps. It's a large clinic type population. Complicated surgery from the VA is sent to the downtown hospitals, and we have an excellent working relationship with the School of Medicine and with the VA. So each of the 3 has their own specific things that they're known for, and they all cooperate one with another to make the medical school successful.
The biggest thing actually was the sheer amount of cases that they had. Most residents here graduate with around 1,400 cases apiece. I came from another program, and unfortunately my hospital had shut down, and Marshall welcomed me with open arms. It was a very good family environment, and on top of that, they could accommodate the caseload. I'm a 4th year resident, and I have well over 700 cases already, with the minimum requirement being 850. So there's plenty to go around.
So originally from Toronto, Ontario, Coming here for the interview, the first time I ever visited Huntington, West Virginia, it was definitely a culture shock, used to the city life, not really used to this more rural environment. But I gotta say, after 3 years of living here, it definitely feels like home now. It's a slower pace of life outside the hospital, lots of things to do to unwind, lots of outdoors activity, a lot of things that I never thought I would do.
I think that there are two things that are important to consider when looking at a general surgery residency. One, do I fit in? And two, can that residency get me to where I want to be? I felt like I fit in at Marshall due to the collegial atmosphere, and then I feel like at the end of my 5 years here at Marshall, I will be a competent general surgeon, but that it's given me the framework to go ahead and be a successful plastic surgeon in my 3-year fellowship that starts in 2021.
We care for one another. You know, the residents get along, they're friends. When I interview people, I always tell them that, you know, the people that you meet and are associated with and as a surgery resident will be your friends in your entire life. And this program provides the opportunity for you to make these long-lasting friendships. And it also gives you an opportunity to be a well-rounded surgeon. We have a phenomenal amount of operations that we do. We are engaged actively in endoscopy, in trauma care, in cancer type surgery, colorectal surgery, vascular surgery. So once you finish training here, you should be able to function as a competent general surgeon. You may want to do a fellowship, but it's probably not necessary.
Well, I chose Marshall for multiple reasons actually, but the main things that stood out to me were the patient diversity and actually the variety of cases that they're actually exposed to. In addition to that, actually how the residents interacted as a family. That's what really stood out to me because I'm spending the next 5 years of my life here. So not just a matter of training, but these are people who are going to become my family. And just seeing how they interacted in general together, I mean, both at work and outside of work, that really stood out to me and that made Marshall my #1 choice.
We really hope that you'll consider Marshall University's general surgery residency. Go Herd!